So this isn't my push for big pharma. I am not a fan of big pharma. They need to be looked at very carefully and very critically, as opposed to just saying, well, these are herbs. They're, all natural. They've been used for centuries. Hello, this is Dr. Wells with Wells Medicine. And I wanted to caution patients today about psychedelics, because there are some risks involved that I think need to be taken really seriously. There's sort of a halo effect around a lot of these medicines as plant medicines or natural medicines, or being seen as, healthy and natural because they've been used for thousands of years. But there are risks involved with them. There are lots of medications that were used for thousands of years that we've found better treatments for. For example, belladonna, a plant medicine, used to be used to help whiten and brighten people's eyes, but it turns out that it's actually very toxic. We used to use lead face paint as part of people's complexion, smoothing out their complexion. It turns out that's really toxic. People used to use mercury to cure syphilis, and it turns out that's really toxic. And I'm sure there are some medications today that, in 50 years we'll look back and say, gosh, we used chemotherapy to treat cancer. But it certainly doesn't mean that everything that is natural or comes from a plant is safe and healthy and good for us or better for us than the medications that we have. I'm really worried that the new legislation on research will encourage more people to think that these are safe medications that no longer need to be studied. The legislation is all about studying them further. And I think when we have more study data, we'll have more safety data to know how to monitor these medications, how to administer them safely, how to use them appropriately, the right patients, the right diagnoses. For example, Ibogaine really needs to have a patient off their other medications before they try Ibogaine, and they really need to have good umbrella of support around them, because it can be a very intense and often negative trip, and that needs a lot of psychological support around them. And then they also need cardiac monitoring, because Ibogaine can cause a lot of cardiac arrhythmias that might need other treatments or interventions to prevent them from being fatal arrhythmias. Psilocybin and LSD can cause serotonin syndrome if the patients are still on their other SSRIs and SNRIs. So a lot of retreats that you see in other countries, if they're at all medically based, they'll have patients stop their SSRIs and SNRIs and other antidepressant medications like benzodiazepines and atypicals for 4 to 6 weeks before they go for their psilocybin, LSD, ayahuasca retreats. And that 4 to 6 weeks can be incredibly difficult. And especially because a lot of patients will do that cold turkey or weaning without the support of their psychiatric, support team, because they're worried about the legality or the judgment of that team because of ayahuasca and psilocybin's sort of weird legal status right now. So patients will feel weird discussing with their care team these medications and that they're going to go try them, worried about judgment or being discouraged from trying them. And so they won't discuss with their prescribing providers that they're weaning off or just stopping these medications cold turkey. And so that can be a disaster for 4 to 6 weeks, where they can have increased suicidal ideation, horrible withdrawal symptoms. And then when they're on the ayahuasca or the LSD or psilocybin, that can be very mentally distressing. And then, they come back to their, these aren't legal in Texas. So if they go to other states like Colorado or Washington or Oregon, or they go to Peru or Costa Rica or Brazil to do these interventions, and they come home and they're afraid to talk to their providers because of judgment around stopping the medications or taking these, somewhat illegal interventions, and the judgment around that. And then they don't have the support of people who know enough about these interventions. So if you go to a typical psychiatrist in Houston and you talk about psilocybin or ayahuasca, they're not going to have a deep background in these to know how to even support those patients, or how to get them back on their medications, or how to help them with the psychiatric interventions around that. And so it's really important to have more research and more study on these, and not just sort of blanket assume that they're going to be natural, beneficial interventions that have no risks and no side effects. So I'm really excited about these things coming on board, the research into them, but they're kind of years away from being studied well enough and having, sort of a judgment-free zone around them, and knowing what interventions we need to monitor, who's the best candidate, what diagnoses are the best for these treatments, how to wean off or discontinue what medications before these. I think, they need to be looked at very carefully and very critically, as opposed to just saying, well, these are herbs, they're, all natural, they've been used for centuries. There are a lot of things that fit into the herb, all natural, been used for centuries, that we either know now are actually risky and unsafe, or that we know through study and having more of an idea of bad outcomes, who won't benefit from these, where the risk involved is worth it for some patients, and how to best prepare them in a way that isn't cold turkeying people off their medications and increasing their suicidal ideation and withdrawal for that 4 to 6 weeks before they go and take these medications. So this isn't my push for big pharma. I am not a fan of big pharma, but this is my desire to have these substances treated with the same clinical research, data, the same perspectives that we use for medications that we use now, risk benefit, and who would best benefit by these, and how to monitor them. So like, subscribe, and leave me a comment below. We always get lots of comments on our psychedelic medication videos. If you like this content, leave me a question and we'll try to answer it in another video. Thanks so much.